simply by fixing their digestive symptoms, they were able to get rid of the hearing aid.
Your gut health is so tied into so many processes that there are early signs of it becoming dysfunctional. And then as that becomes more chronic, you see larger scale impacts. Hi, everybody. Welcome to another exciting episode. And we're really excited today to talk about, I think this was something we kind of brought up really loosely in our last episodes. We really wanted to dive further into this concept of leaky gut. And if this is your first time joining us, please look back at the other episodes. We cover a wide variety of topics around gut health, a-FMT or fecal microbiota transplantation, and kind of how those two things go together in terms of different conditions inside and outside the gut. And if you're joining us again, please subscribe and make sure to join us every time we post, because we're continuously kind of growing these topics and we're always looking for suggestions. So leave a comment at the bottom so we can try to incorporate things that would be of interest to you as well. So
Yes.
As I talked about, we're going to talk about leaky gut today, and I'm going to let Jason take the lead on this because you have some kind of clinical experience seeing leaky gut in the wild. So I'll let you take the lead.
Yeah, it's somewhat of a controversial topic. You know, some people debate whether or not leaky gut is even really a thing. I think the name is not the best name. It sort of comes across as gimmicky. Gut permeability is much more common. There are tests that people do to see if there is leaky gut, but there's a lot of symptoms, and frankly, a lot of people with different disease states could identify with these symptoms. And so that's in part what makes it challenging to understand, like, is this truly leaky gut, or are these symptoms of some other disease or disease process? And so it really varies. I mean, it covers symptoms body-wide, and that's the impact that having gut permeability or leaky gut can really have. But from a digestive standpoint, it almost looks a lot like irritable bowel syndrome, where there could be gas, there could be bloating, in some cases diarrhea, abdominal pain, food sensitivities or sort of food allergies, which is something we can definitely cover in more detail. And I want to talk about the physiology and process of how that works. There can be skin issues. People often forget that, or just outright don't know that actually the skin and the digestive tract are derived from the same tissues embryologically. So as the fetus is developing, the tissues that form the skin and that form the gut are the same. And in fact, the gut is really just skin turned inside out and happens to be inside of you. So the digestive tract is actually considered like an external organ. It just happens to be inside of you. So it's kind of a wonky thing embryologically, but they're very much the same. And so whenever I was interacting with patients in my past life, I would always inform them, like, if you're having skin issues, you have to look internally. And the expression I would use is like, the skin is a mirror to the gut. So if you're seeing skin issues, most likely it comes down to something that's happening within your digestive tract, and that needs to be addressed. Just putting on topical steroids is going to be reducing the symptoms of, say, eczema or acne or rashes. But ultimately, the issue in many cases is actually much deeper and lies within the gut. As well, there can be some sort of mental emotional symptoms, whether it be brain fog or anxiety or depression, even fatigue. A lot of times people would note eating a meal, and then following the meal, they're dealing with fatigue or some brain fog or even anxiety. And these potentially are symptoms of gut permeability, leaky gut. In more extreme cases, it can impact and sort of create this almost like autoimmune inflammatory type picture, where it might look like joint pain or muscle aching, and even flare-ups of autoimmunity. If someone's like really off of their diet and say they have like Hashimoto's, they could start seeing an impact on their thyroid hormones. And other symptoms could look like headaches. Not a lot of people are testing for this, but there might be poor absorption of minerals and vitamins. And so that could look like nutrient deficiencies. And then also, this is again pretty broad, but just the person who's just getting chronically sick, they're picking up every bug there is. It's an indication that their immune system is impacted. And so that's a little bit of how I want to think about this, is like break it down to the simplest form. So the gut lining is only a few cells thick. It's actually replacing itself very frequently. Don't quote me, but I think every 7 days, the lining of the gut is being replaced. And so it is really something that can be healed fairly quickly, as long as there's not an inflammatory picture going on. And often what's creating the inflammation is either foods that are creating the inflammation that are damaging to the gut lining, or there's a gut microbiome imbalance. And that imbalance is resulting in an inflammatory response, an overgrowth potentially of pathogens or fungal overgrowth, as well as when you don't have the correct microbes or the correct balance of those microbes, you're not producing the short chain fatty acids that act in a way as an anti-inflammatory as well as a fuel source for the lining of the gut and the gut barrier. And so what begins to happen is you start to get there's these junctions that are in the gut. They're called gap junctions, and they should be, sort of tight. And there shouldn't be a lot of stuff leaking through or being able to pass through this membrane. And if they do pass through, they should pass through when the food or the proteins are digested enough that the body recognizes them as a digested food protein in their more broken down form as an amino acid or broken down fats. And so this lining has tight junctions, and that's how it should be performing. And if it's not, if there's a lot of inflammation, you can begin to get a separation in these gap junctions. You can start to get a space that's formed between the cells. And what then happens is partially digested foods and food proteins are able to leak through, hence the term leaky gut. These larger food proteins are leaking through. And the body, given all of its intelligence, is actually, programmed to run very simply. It sees this large food protein leak through. It doesn't know what it is. And so the first thing the body does when it sees something that appears to be foreign is it attacks it. It creates an immune response to that food protein. If it's too large, it's unrecognized. And so this could be, for example, an egg. Someone's eating egg, and these larger proteins that are not fully digested are leaking through these gap junctions that are too large. And then the body creates this immune response. And the more that it's exposed to these larger proteins, the more that it's like building up this inflammatory response, all these immunoglobulins that are attacking the food that's leaking through into the blood and into the bloodstream, which is what the normal process is. And in the process of that, you start to become more and more intolerant to that food. And so the more you eat it, the more you're getting the reaction, and then the stronger the reaction becomes. And so it's just like if you were exposed to a virus or strep, that could be a part of strep throat, like the body's going to go all out attacking it. It thinks there's some invader. And the more times that you're getting this invader, the greater the response is. And so the more and the greater the response, the more of the symptoms you're going to experience, as I described earlier. It's almost like this inflammatory cascade is being released each time. And sometimes the response is more severe or significant. There's a lot of people that most likely have intolerances to foods, but they just don't know it. They're not experiencing all of these overt, significant, severe symptoms. In other cases, it could be really severe. And in an extended case, it can develop from like a food intolerance all the way up to like a food allergy type response where it moves, and we don't need to go into the weeds here, but from like a type 2 to a type 1 type of a response. And so this is the overall picture. And then what's happening is these food proteins are leaking into the body. They can form in joints. I mentioned like joint pain, muscle aches. We can start to get these immune protein complexes that are ending up in joints, in muscles, and it's creating pain. You can get the same food protein immune complexes crossing through the blood-brain barrier and creating these sort of neurological, mental, emotional type symptoms. And I think, and this is really not the topic for today, but there's some indication that having this gut permeability is also having an impact on the blood-brain barrier, which is another barrier similarly designed, although different, that protects the brain from the rest of the body. And so if you have a breakdown and a lot of inflammation that's impacting your gut barrier, there's also that same impact on the blood-brain barrier. And that's why there's this connection between having GI symptoms and oftentimes a lot of the brain fog type related symptoms as well. And
I think
so,
that's kind of cool to think about too, though, because I think people understand how important the blood-brain barrier is. We hear more about it. We talk about it in terms of drugs and protecting our brain. It's kind of a well-known system. And the idea is it's tight junctions that kind of protect it. The gut is trying to do the same thing. And so you have these tight junctions. They're very selective about what it's going to let in and out. And then when that system starts to fall apart, then you get negative outcomes, and they are similar. And when you really think about how we're made from a grouping of cells that comes to keep dividing into being people, a lot of these tissues are very similar and they do similar things. They're just in different parts of the body. And I think it's a really interesting concept to think about. Could that enhanced inflammation coming from the gut being dysfunctional start to impact other tight junctions in the body? And maybe that's why we are seeing more neurological conditions being tied to early gut dysfunction.
yeah, and I mentioned, a big part of the discussion was talking about foods and food intolerances. But there's a lot of other things that both create inflammation and damage the gut wall lining. And this is absolute fact. As an example, alcohol. I mean, it's toxic to your gut. It damages the gut cell lining. And there's many other things, right? There are chemicals, pesticides, herbicides, like all the stuff that's very commonly included in foods, high sugar, high fructose corn syrups, those types of things create damage to the lining of the gut. And this is another part that I think is really fascinating, is that we're starting to see the significant rise, and we have talked about this previously, but of non-alcoholic fatty liver disease. And a big part of that is because these inflammatory, compounds, this inflammatory response is being fed back to the liver, because the liver is processing everything that comes from digestion, and it's fed there through the hepatic portal vein. And when you're getting a lot of this inflammation that's being sent from the digestive tract over to the liver, along with everything else that's being sent there for further breakdown in the different phases of liver, the processing phase 1, phase 2 of the liver, you start to then create this inflammatory response in the liver. And the response of the liver is to create these fatty cells that surround the liver, which again is a big part of it is diet related. We definitely know that's the case, but also it's this inflammatory stuff that's leaking through as a part of this leaky gut permeability situation. And so how do we address all of this, right? How do we deal with the blood-brain barrier, the fatty liver disease, the gut permeability? It really does come down to improving the lining of this gut. And the way to do that ultimately is to reduce the inflammation and remove the triggers that are causing damage to the gut lining. I mean, the obvious ones, of course, are like, eating a cleaner diet, cutting out these inflammatory foods that we know are inflammatory. And some people do really well on like a restriction elimination type diet, where they make their diet really simple for a short period of time. Again, as I mentioned, the lining of the gut can heal up in like a week, 2 weeks. It's like totally new, as long as you're not continually exposing it to inflammation and you're supporting it to heal and recover. And there's a lot of supplements and herbs and things like that, and we won't get into all of that today, that could be included as a part of this. But that's the idea, is like really reducing the amount of inflammatory things that you're consuming. So, cutting out the alcohol, cutting out the junk food and the high fructose corn syrup drinks and all the things that we know are damaging to the gut lining. There's a lot of things, again, you could support. High dosing of vitamin C, as an example, is really supportive of gut health. And then ultimately supporting the microbiome. This is a really key player, and something, of course, that we're very much involved in with the fecal microbiota transplant space, is that if there is an imbalance within the gut, there's too many of a certain type of a microbe, there's not enough of a certain microbes, or there's actually pathogenic microbes in the gut, or even there's microbes in the wrong area. And we're not going to go into the depths of this today, but SIBO, small intestinal bacterial overgrowth, is really when you have bacteria that belong in the large intestine that end up in the small intestine, and that creates an inflammatory response. It's creating gas, it's creating bloating because it's exposed these fibers are being digested prematurely. And as fibers are digested, they're releasing gases. That should happen in the colon, not in the small intestine. And that's where, again, we're creating this inflammatory response. It can cause diarrhea. In some cases, depending on the gases, can cause constipation. But ultimately, you're again aggravating the gut lining. And I think this SIBO situation is really a result of a colonic dysbiosis or imbalance within the colon. And so, again, controlling the diet will play a really key role in helping to moderate some of this overgrowth, reducing fungal overloads, and then helping to create stability among the amount of bacteria and the different types of bacteria. Of course, in the more extreme cases where the digestive system and the microbiome have been obliterated and it's developed into disease, whether that's C. diff, whether that's, inflammatory bowel disease, chronic IBS, and then the symptoms outside of it, which might be neurological diseases or what have you, there may be an indication, of course, to do FMT, which is a more permanent fix. Because once you've lost the bacteria, they're gone. Say you've had too many antibiotics or you've been on a diet for a very long time that hasn't been supportive of healthy gut microbiome, then you may, FMT may be a consideration. And that's my theory on really a big part of how FMT works. It might be shocking to those of you listening, but we don't really know how FMT works. It's not obvious to us. It's not just adding in new bacteria that's doing it. I think in large part, what's making it work is it's reducing inflammation in the gut. It's moderating the inflammatory response as a part of the immune system, which is very linked and integrated with the gut. And so I think that's a big part of how it's working, is reducing inflammation in the gut. And as we do that, it reduces inflammation in the rest of the body. And that's how we're seeing, patients that are dealing with both GI symptoms and neurological symptoms improve solely through treating the gut microbiome and improving digestive and gut health.
Yeah, and I think that it may go together or one may allow the other. This restoring the microbiome and allowing there to be the diversity that is required plays a big role, but a functioning gut allows for the kind of inflammatory processes. I want to use the word reset. I don't know if that's the right word, but the idea is it's dysfunctional. And by allowing there to be a baseline for it to function properly, these two things, and it could be that anti-inflammatory comes first and that allows for the gut bacteria to survive. It's hard to say, but it's one of the interesting things about FMT is that we don't know the method of action. And it's kind of like we know what is a good indicator that there's something wrong and FMT could help. And we know what it looks like when it's done. So we see the shift in profile, we see improvements in symptoms. And what's happening in the middle is kind of unknown. But I think the further we go down the path of understanding gut health and how that connects to chronic disease, I think we're seeing that it's definitely, and it's hard to know, is it a symptom from having, or does it cause a condition? Again, we don't know the causative relationship, but we do know that it's so tied in. Your gut health is so tied into so many processes that there are early signs of it becoming dysfunctional. And then as that becomes more chronic, you see larger scale impacts. And, we see this in some of the research in terms of looking at more chronic conditions that are definitely outside the gut, something that's what we originally considered as being almost 100% neurologically based or 100% just the immune system. And now we're seeing early on, consistently, there are signs that there is gut dysfunction and that was left to kind of become more and more chronic, where other symptoms and other systems become dysfunctional. And so,
and this is like clinically, any physician listening to this who's treating more functionally in an integrative way will have seen this over and over. You're healing a patient's digestive system, and that's all you're doing. And then other systems or symptoms are improving or going away. I just had a really interesting case once, a patient who had they couldn't even play the piano, and they loved piano because they had basically like arthritis in their hands, but they also had a lot of GI symptoms. And we did nothing to try to address the arthritis in the hands. That wasn't the obvious thing to start with. It was the gut. And by improving the gut health and gut function, the arthritis improved so significantly that the patient could again begin to play the piano without pain. And that's a classic case. I had another one where and this shocked me, and this is why I remember it so well of, thousands of cases, but is the improvement in hearing. This patient literally had hearing aids and had struggled to hear. And by improving digestive function and getting rid of a lot of these GI symptoms and inflammatory stuff they were going through, they didn't need their hearing aids anymore. I mean, it was shocking. It made me wonder, like, really? Is this a thing? Yeah, they were like, this is too loud. They needed to literally turn off and get rid of the hearing aids. And they were also younger. They weren't, that there's no like obvious reason that they should have needed hearing aids outside, of course, having spent perhaps a lot of time in a band or something like that. They were young enough, I think in their 50s or early 60s, where it wasn't obvious that they should need hearing aids. And simply by fixing their digestive symptoms, they were able to get rid of the hearing aids. And this shows up in autoimmune cases where you improve digestive function and the autoimmune markers come in line. And this applies, to so many different types of disease states where simply improving digestive health, you're able to improve all of these other types of markers. And ultimately, you're reducing inflammation. And as a part of reducing inflammation, you're allowing to heal the gut lining and gut barrier. And so, yeah, it's an exciting space. I think FMT plays a really important role in these more chronic, severe cases where making dietary changes, adding in supplements just isn't going to cut it anymore. When it's presented in a full-blown disease, we need to be more aggressive, if you will, about how we're dealing with this. This isn't to say we don't need to do all the foundational stuff. And this is a big part of how we work with doctors, is supporting them in understanding how to support the patient before even starting the FMT. And we call that pre-treatment. So it's what you do before you start the FMT treatment itself. And that could look like a lot of stuff, but ultimately it's dealing with overgrowth. It's trying to support the dietary side. It's doing a bowel cleanse. It's fasting potentially. There's a lot of aspects that can come into play as part of the pre-treatment approach to FMT treatment more globally. And that's a big part of how we support doctors who are trying to implement this in their practice to get the best possible outcomes for patients. And so naturally, if you're a doctor and you're listening to this and it's fascinating to you and you want to learn more, reach out. I mean, we're here as a resource. Prior to really focusing in on treating patients with FMT, I was primarily focused on just treating digestive health patients. And that's ultimately the story of how I got into working with FMT as it was. And so treated a ton of irritable bowel syndrome, small intestinal bacterial overgrowth, and a lot of IBD patients. And of course, anybody with those subset of diseases also has a lot of other conditions. But that's what led me to learning about and exploring FMT for patients and where we are today. So if you're running a practice and or have patients who are dealing with those types of conditions, we'd be more than happy to connect. And I'd be more than happy personally to share all of my learnings and experiences and supporting you in your journey to helping more patients.
Yeah, I think we want to answer questions about where the gut plays a role. And while, FMT is our space, we understand that, getting knowledge and understanding where the gut plays a role in multiple different areas. And if you kind of have a question mark of I have all these things and I don't understand what's happening, asking, reaching out to us and asking a question about, do you think the gut could play a role here? Can you walk me through how this could be a puzzle piece? That's what we're here to do. And thank you so much, Jason, for kind of jumping in and kind of explaining this, because it is an area that I think is gaining more interest. And I think while leaky gut kind of maybe something we talk about in one facet of one group in traditional medicine, we're seeing more and more the idea of this increased permeability, which really are just, the same thing in two different names. But I think it's a growing understanding of that these junctions are important and they are impacting. So I think kind of providing some insights and your knowledge on this, I think will be a great resource for people. And if you've
happy to rant, this was fun.
Reach out. Jason's always looking for someone to rant about leaky gut too. So reach out and keep following along. We'll have another interesting topic on the next one. And thank you for joining us. If you have questions, you can always check out our website. It'll be in the description. And or you can just reach out to us or leave a comment. And we're always looking to make sure that we're answering anything about anything that people reach out about. Thank you so much for joining us.
See you on the next one.